Uh, Good morning, everyone. I'd first like to start by thanking everybody for taking their time out of what I know to be busy schedules at this time of year to come join us to talk about what we believe to be a very, very important, not only human issue, but a financial issue also. As the boards indicate, right now the state spends almost 10% of its state budget on long-term care costs. We have an aging population in Connecticut. We're the seventh oldest in the country. Presently, we have about 14% of our population over the age of 65. And with 80 and 90-year-old, our fastest growing demographic, by 2032, we will have almost 25% of the state demographic over the age of 65. As a current trend, with 14% yielding a 10% cost, when we double that, can we sustain that type of appropriation in the future? My response to that is no. We're having a tough time meeting that challenge now. It's going to be more so difficult going forward. Given the fact that when you talk to seniors and ask them how they want to age in place, they will tell you that no one wants to go to a nursing home. We know that community-based services are arguably better and less expensive. Given that, it's a no-brainer. When we look at the statistics that show that only 8% of our population has long-term care insurance, and that the biggest inhibitor to purchasing that insurance is its cost, because it's on average $3,000 a policy, I think this letter and proposal makes sense to urge our fellow legislators in Washington to give taxpayers a tax deduction on their federal returns when they buy long-term care so that we can get more, I'm going to say, personal responsibility on the purchase of long-term care insurance to enable those individuals to age in place in the manner that they want. With that, I'd like to turn it over to my colleague, Senator Crisco, for a couple comments.
Thank you, Senator. First, let me commend you on your leadership in this very important issue of long-term care. As we have witnessed, there has been numerous articles about the silver tsunami, and that, is a new term that we're all familiar with. What that means, to our country and to the people of Connecticut. The Insurance Committee was very, very proud to adopt several pieces of long-term care insurance. One, which we're very proud of, which would even out the great increases in premiums for policyholders. Because of previous actuarial tables, there are some discrepancies in balancing out the fiscal worthiness of long-term policies. So we've addressed that. This is so important. And it's not only the caring, the services that are needed, but the mental aspect. And we've seen numerous reports about if people have less to worry about, they enjoy better health and become, better, citizens of their community. So I just want to commend Senator Kelly again and my colleagues, Representative Megna and Maroney and Wright and Senator Boucher, for all their commitment to this. It's something that's not that sexy or get that much attention, but it's so crucial because of the silver tsunami that we're facing. Thank you.
Yeah, I'd also like to commend Senator Kelly for his leadership on this issue. He's been wonderful on it. He helped work through Senate Bill 9, which is a disclosure bill on long-term care. It's on its way over to the governor's office as we speak. And the last few years in front of our Insurance and Real Estate Committee, we've heard such an outspoken public on this issue. We've had many, we actually had a long-term care tax credit bill that was in front of our committee, which was difficult to move forward with our budget situation in the state, but we were successful in getting through Senate Bill 199, which helps to take the bite out of that initial huge premium increase that a lot of people are feeling with long-term care, and it also provides a flexibility for people that are there paying those premiums and may want flexibility in the coverage to help them deal with that premium as they age and those premiums, some of those premiums skyrocket. So I'd like to commend Senator Kelly, and I'm glad that we're coming together on this important issue for the aging population of this state.
Representative Wright, you want to, Maroney? No? Senator Boucher?
Actually, our bell rang.
Your bell rang? Okay. Well, thank you.
Well, I would like to commend the leadership of, on both sides of the aisle, on the insurance committee. This is an issue that was just stated, isn't always a sexy issue, doesn't get the attention that it should, but it is a growing issue. I thank them on behalf of my own family, but also on behalf of all my constituents. I have received a number of calls by the part of our constituents that talk about the costs of their long-term plans that have escalated so greatly, or in some cases, some of the businesses have gone out of business, in fact. And some of that is because some of the experience that is now being had is that instead of the 3 years that typically these policies are needed for, that many citizens are living it to a greater degree and could be in long-term care for upwards of 3, 5, 6 years, even more, and that outspends what was actuarially accounted for originally. So it is an industry that is incredibly necessary, but it's also going through some difficult growing pains as well. So oversight is important. The safeguards that were proposed were outstanding, and I thoroughly support a federal tax exemption for any expenditure in this area, because we want to encourage people to take on these policies that are oftentimes very expensive but so needed, because if not, if they don't have these policies, then they become a burden to the states in which they reside and also to a lot of our budgets as well. So again, I commend everyone on this committee, and I thank them on behalf of our constituents.
Thank you. Now I'd like to introduce Julia Evans Starr, the Executive Director of the Connecticut Legislative Commission on Aging.
Thank you, Senator Kelly. It's an honor to stand with all of you and on behalf of all of you, actually. This is an issue that the Commission has long prioritized. That is to encourage planning, to create parity, and to really work toward realizing choice in long-term care. There's no doubt about it, long-term care insurance is a tough sell. It's hard for people to commit to making premium payments over the course of time when they don't know if they're going to need the services on the other end. But the truth is, yes, long-term care insurance is costly, but we also know there's a very high likelihood that you will need long-term services and supports at some point in your life. As a matter of fact, research shows that up to 70% of folks will need long-term services and supports. And when you think about it, I mean, think about your lives. Think about the people around you. I'm sure it's already impacted those around you. Your parents, your siblings, maybe your children, and eventually ourselves. So this is an issue that hits very close to home. And what are we talking about here? The types of services can range across the continuum. It could be just as small as personal assistance for daily activities, or it could be total care. The settings that these services are provided could be in your home, or it could be in institutions, or the settings across the continuum. You've heard about the urgency. We know about baby boomers, this silver tsunami, some 76 million people in Connecticut, across the country. In Connecticut, it's 1 million people, close to a third of our population, so it's impacting us. And as Senator Kelly told you, we're already the 7th oldest state in the nation. So the urgency is there. The goal is to incent people to really plan, and long-term care insurance is such an important piece of doing so. We need to make sure it's affordable. So what do we need to do? We kind of need to sweeten the deal to incent people. And Connecticut has a vested interest in doing so, as you heard. If you can't pay for your own care through insurance and other means, the fallback is the state and Medicaid. It's roughly 10% of our state budget. Long-term service and supports, those expenditures are 10% or $3 billion. So that's only going to grow. And so the goal here is clear. We want to encourage people to prepare and plan, and they have a vested interest in doing so as well as the state. So that's all I'd like to say. I just want to thank you for your attention to this very important issue. To hear it's not sexy from the Commission on Aging is kind of jarring, but probably good to know. And I just wish you much success.
And now I'd like to introduce Lori Julian, who's the Director of Public Policy for the Alzheimer's Association.
Thank you. Good morning. Thank you very much. Alzheimer's is one of the most expensive diseases in America, and the strain on the families, individuals with the disease, they're high users of health care, long-term care system. So this is really a good policy. The strain on government, Medicare, Medicaid, most people do not have the funds to have the care that they will need should they get the disease. It is one of the most expensive maladies, and it's expected to grow along with the aging population. In fact, by 2050, if we don't find a cure, which there is none today, we anticipate it will double by 2050. So you can see the strain on society, strain on families, and again, the long-term care system. So we applaud the senators and representatives for taking on this issue and hope that the congressional delegation will follow. Also, this was a recommendation of the Alzheimer's Task Force that convened last fall and made recommendations, and we hope that it will be implemented as well. Again, thank you for your time.
I'd now like to introduce State Representative from the 105th District, Teresa Conroy, who, like me, represents the good people of Seymour.
Thank you, Senator Kelly. You've probably already heard everything that I'm just going to reiterate on. We do have the silver tsunami that's hitting, thanks to Julia Starr Evans for bringing that out and making it such a priority in this state. I have friends and family that say they don't have long-term health insurance because they just can't afford it, and there is no incentive for them to be even thinking about doing it. Going forward with this, if we can have more people doing it, it's kind of like, I always say we might not have money now, but if we can be in the planning stages to make sure we're not having another crisis, this is just going to be another crisis. We're an elderly population that's just growing in this state, and we need to make sure that they're going to have the resources available to be able to have them being cared for. It used to be in the old days, the family always took care of the people. It's not like that in our society anymore. So I want to applaud everyone here today for taking the time and the initiative, the task force, Alzheimer's, to be able to bring this to the forefront and make it a priority for our state, because what we invest into this now is just going to help us down the road. So thank you all today.
And thank you. I'd once again just like to thank my fellow senators Boucher and Crisco and Representative Conroy, as well as Wright and Maroney, as well as Chairman Magna from the House, as well as Julia Evans Starr and Lori Julian. I think the point that we really want to drive home is, while the tax credit is a tax appropriation, it's an investment in avoiding a significant cost that we're already bearing, 10% of the state budget. That is significant. And this would be an investment in helping to reduce that cost going forward. The second part, which I think is more important, or just as important, is that this isn't one side or the other. It's not a Republican issue. It's not a Democrat issue. This is a human issue. It's really about, how do we want to have our health care delivery system to our seniors in the future? Do we want to do it in the institutional setting, which, when you talk with people, 95 to 98% of them will say, no, I want to age in place. This helps people do that. So we're focusing on the people, and I think that's a good point to do, and that's why we have bipartisan support, and it makes fiscal sense. So thank you, and we'll conclude on that.